Welcome to the second video in the series of discussing the treatment plan of hair loss in different grades of Norwood Hamilton. So in the previous video, we discussed grade 1, 2, 3 and this video will be discussing grade 4 and 5 of hair loss. What all options you have for management, what all things can be done, medical treatment, surgical treatment, scalp micropigmentation if required, and how do we proceed for it. My name is Dr. Preeti Saraswat. I'm American board certified hair transplant surgeon. Subscribe to this channel for more informative videos and testimonials. Grade 4 Norwood Hamilton baldness, we say when you have lost most of the frontoparietal area, but you may have some forelock in the front, some tuft of hair in the front, and also some fringes of diffuse hair in between towards the back. So a major area in the front and mid scalp is gone, but you still have hair here. This is grade 4. In grade 5, the whole of frontoparietal area is clean. It is almost horseshoe shaped, but the band of hair in between, sometimes it may be seen going and sometimes it may be lost completely. So usually we see patients who are not exactly the type of grade which is specified in the books, but somewhere in between is very common to find, and thus the treatment plan usually depends on how much the grade is, but as such there is no specific indication that this grade will be this and this grade will be this treatment wise. So now we will be going to the treatment part. We created this series to educate you about the hair loss problem you have, the grade of it, and how you are going to manage it. If you like this, click on the like icon. So we'll be discussing the medical treatment for the existing hairs, the surgical treatment for the bald part, and densification. Densification we'll be discussing towards the end of the video. Coming to the medical treatment first. So as per US FDA, again I would like to tell you that the medical treatment consists of finasteride and minoxidil. Usually finasteride is given orally, though now topical solution has come along with minoxidil, and minoxidil is given topically, though now oral tablets have come now in the market. So you can have a consultation with your doctor so that you get the medical treatment for the existing hairs, which is very, very important. The importance cannot be overemphasized, because even if you get the surgical treatment for the bald areas, you need to conserve the existing hairs nicely so that you can flaunt good hair. So medical treatment along with therapies. Coming to therapies, you can again opt for PRP therapy, platelet-rich plasma, mesotherapy, which are pre-made cocktails of solutions, growth factors, which are good for your hair, then low-level laser therapy, and derma rollers. So here at Saraswat Hospital, we always give you triple therapy so that in a single session, you get the benefit of low-level laser therapy, derma roller, as well as PRP or mesotherapy. And this we can repeat at particular sessions, and you get medical therapy with these PRPs, and you get the best of benefits in this way. Coming to the surgical therapy. So for grade 4, we can opt for surgical therapy because the extent of hair loss is quite a lot. The frontoparietal region is gone. So when you come for consultation, we always, after trichoscopy, after finding out the assessment, computerized assessment of your donor and recipient area, we make a long-term plan for you. We find out how many grafts you have at the donor area. Then we make the area of recipient side so that we know in centimeter squares what is the area of recipient side. Then we multiply it by the density required by you, and then since you are grade 4, you must be having the grafts at the back of scalp only. There is no other donor area required, and the number of grafts usually goes somewhere from 2200 to 3000 in between. So this is usually done by FUE or FUT also. If you and your consultant agree for it, whatever procedure is good for you is told to you. And here at our place, we always do a long-term planning for you before actually you undergo the procedure. Coming to the surgical treatment for grade 5. In the grade 5 surgical treatment, again the same procedure is done, your trichoscopy, so that we have a full page of number of grafts you have, what is the thickness of hair at the back donor side in both the parietal areas, then what is the area of the recipient side, how many 2-head grafts you have, how many 3, 4 head, single head, how many grafts you require, then multiply multiplied by the area, how many total number of grafts is required by you. After all this calculation, we then see whether you are a good candidate for hair transplant or not, and after the whole of discussion, a proper planning is done for you. If you have any question regarding your own particular case, you can write in the comment section below. We will be happy to answer, or you can call us on the numbers below so that we can arrange a consultation for you. I want to discuss a very important point here, that you lose a particular number of grafts from the bald area, and in order to have again hair here, we take grafts from the area behind, which is the safe donor area. Now, the number of grafts which you lose is much more than the number of grafts which are available at the back, because previously you had the same density here and here, but according to the text, we know that about 50% of hair is lost when you see the thinning. So from the back, if we take less than 50% of your hair by FUE method, or in case of FUT, we can take a strip. So let us talk about FUE. If we take less than 50% of hair, it would give you around 50% of density only in the front. But this would be implanted artistically and in a way that you get proper framing of face, you get a good hairline, you get good locks of hair, but still there can be someone who can feel that my scalp is still little visible. I don't want this visibility anymore since I have undergone hair transplant. So for them, there is a choice that they undergo hair transplant again, but then where to find the grafts now? So a more intelligent choice in my view is that you can opt for scalp micropigmentation. What it does, it densifies your hair so that the scalp visibility is reduced to a minimum. To know more about scalp micropigmentation, you can click on the video link above. If you have your friends or someone in the family who is suffering from this kind of a hair loss, grade 4 or 5, do share this video with them so that they are educated about the options they have for treatment and planning. In order to know more about treatment of initial stages of hair loss grade 1, 2 and 3, click the video on the left, and in order to see a testimonial of patients suffering from baldness grade 4 and 5, click the video on the right.